Welcome back to the channel. If you're watching this, you probably already know the truth. Nursing is incredible, rewarding work, but it is also exhausting. Some shifts feel like you are running a marathon while juggling flaming torches, all while trying to keep your patients safe and happy. Whether you're a brand new grad fresh off orientation or a seasoned vet feeling the burnout creeping in, we all need strategies to manage the chaos. It's not just about surviving the 12 hours, it's about thriving and ensuring you have energy left for your life outside the hospital. Today, we are breaking down 5 essential practical tips that will help you organize your brain, prioritize your tasks, and actually get out on time. Let's dive in. Tip number 1: master your nurse brain. Your report sheet is your lifeline. If your brain sheet is a mess, your shift will be a mess. Too many nurses try to use the generic printout the hospital provides. Stop doing that. You need to develop a system that works for how you think. Create your own template. It should have dedicated spaces for the things you look for constantly: the last set of vitals, the next pain medication due time, pending labs, and the discharge plan. And here's the pro tip: color coding. Use a red pen for anything stat or urgent, like a critical lab value you need to report. Use a highlighter for time sensitive medications, like insulin or antibiotics. When you glance down at your clipboard in the middle of a chaotic emergency, those colors will jump out at you, ensuring nothing critical gets missed. An organized brain sheet equals an organized mind. Tip number 2 is perhaps the hardest skill to learn: the art of prioritization. The biggest myth in nursing is that you need to be a good multitasker. The truth is, humans cannot effectively multitask complex things. What you are actually doing is task switching. And every time you switch, you lose focus and risk making an error. Instead of trying to do 5 things at once badly, do one important thing at a time well. But how do you choose? You always go back to your foundation: ABCS: airway, breathing, circulation. Safety always trumps comfort. Here's a practical exercise. At the start of your shift, identify the 2 or 3 must do tasks for each patient that will move them toward discharge or stability. Everything else is secondary. If patient A needs pain meds, but patient B's blood pressure just dropped to 80/40, patient A has to wait. It sounds harsh, but prioritization is about recognizing unstable versus stable. Don't let the non urgent tasks drown out the critical ones. Tip number 3: chart smarter, not harder. Documentation is the bane of our existence. It feels like we spend more time treating the computer screen than the patient. But staying late every single shift to catch up on charting is a fast track to burnout. The golden rule is chart as you go. I know it's easier said than done, but even if you just chart the vital signs and the assessment right after you leave the room, you are saving future you a massive headache. Do not double chart. If the vital signs automatically flow into the flow sheets from the monitor, do not type them again in a nursing note. And finally, embrace charting by exception if your facility allows it. If everything is within normal limits, check the box that says so. You don't need to write a novel stating that the patient's skin is intact, warm, and dry if you already checked the WDL box. Only write narratives for the abnormalities or specific events. Be concise, be factual, and move on. Tip number 4: communicate like a professional. This is especially important when calling providers, especially in the middle of the night. Doctors and nurse practitioners are busy and they often think in a different structure than nurses do. To get what your patient needs quickly, you have to speak their language. Use SBAR every single time. Before you even dial the phone, have your SBAR ready. Situation: who are you? Who is the patient? And what is the immediate problem? Background: what is the relevant context? The diagnosis, recent labs, or code status? Assessment: what do you think is going on? For example, I am concerned his respiratory status is declining. Recommendation: what do you want? I need an order for a chest x ray. Or, I need you to come see the patient now. When you use SBAR, you sound competent and organized. It cuts down on the back and forth questioning and gets you the orders you need faster. Don't ramble. Just give the facts. Our final tip, number 5, is the most important one: the oxygen mask principle. You know the speech on airplanes. Put your own oxygen mask on before assisting others. You cannot take care of patients effectively if you are dehydrated, starving, and bursting with a full bladder. It is not a badge of honor to go 12 hours without peeing. Drink water. Take your breaks. Seriously, take them. Step off the unit, even if it's just for 10 minutes, to reset your nervous system. Nursing is a long career, not a sprint. Protecting your physical and mental well being is actually a patient safety strategy. These tips won't make the job easy, but they will make it manageable. Try implementing just one of these this week and see the difference it makes. If you found this helpful, please hit that like button and subscribe for more practical nursing content. Hang in there, you're doing important work. We'll see you in the next video.